Hello everyone, this is your host Rohan Tandel from InnoHEALTH Magazine studio. I welcome you to this podcast produced by Innovation Curious with a mission to spread awareness and knowledge of various facets of healthcare innovation. You are listening to the Voices of InnoHealth podcast from InnoHealth Magazine, the first magazine in India on healthcare innovations. In this podcast, we invite various industry leaders and discuss their views on the healthcare industry and innovations. Today, we are going to have a conversation with Dr. Vijay Agarwal. Welcome, Dr. Vijay, to our podcast. How are you today, sir?
Very fine. Thank you very much. And I am looking forward to this conversation.
So, before starting, I would like you to tell us a little bit about your career path and your journey up to this point.
So, as I'm now in my vintage years, I'm approaching 75 years of age. So, that has been a long journey. I did my graduation in 1968 and then post-graduation in 1973 in pediatrics from the Maulana Azad Medical College in New Delhi. I had been practicing as a consultant pediatrician right from 1974, I would say, to almost 2003. I kind of also was very actively engaged in helping small hospitals as the chairperson of the Nursing Home Forum of Delhi Medical Association. And also, therefore, it gave me a great insight into kind of, I would say, managing hospitals. In 2003, I joined Max Group, and I was responsible for setting up the Max hospitals in Saket. I was there as the chief administrator and then director operations, and then left them in 2007. We joined hands with my friend Dr. Vijay Agarwal, and we started a hospital called Pushpanjali Crossley, and which was again given to Max in the year 2015. It is now functioning as Max Vaishali. Since 2015, I have been working to promote patient safety and quality in the country through this organization called CAHO, which is the Consortium of Accredited Healthcare Organizations. And the aim is to reach out to all the stakeholders of the healthcare delivery to make them understand about the issues relating to patient safety. So that's kind of in a nutshell my journey.
That is a great journey, sir. So, now moving to the podcast, talking about innovation, the definition of innovation may be same for everyone, but the meaning, value, or say the influence of the word differs from person to person. So, my question to you is, what does innovation mean to you considering the healthcare industry?
Well, one of the simplest definition, which I think explains it very well, that I came across on the net is that it is the creation, development, and implementation of a new product, process, or service with an aim of improving efficiency, effectiveness, and competitive advantage. So I think this is like self-explanatory.
So, now moving to the next question. How did the COVID pandemic change your perspective on healthcare, especially when it comes to innovation?
Well, during pandemic, the existing ways of delivering healthcare went for a six. Everybody started understanding the importance of innovation. And as they say, necessity is the mother of invention or innovation. Persons delivering healthcare at that time or since that time have been struggling to keep up with the protocols being churned out by the national or international agencies. So a lot of innovations had to be done and were being done to keep the healthcare workers safe and to be able to even attend to the patients. So actually, without innovations, we had a huge problem in the supply chain. We had a huge problem in getting the healthcare workers even. So you can imagine that even the telemedicine, which we had been crying hoarse for a lot of years, and in fact, in the country, there had been judgments which were going against the implementation of telemedicine prior to this pandemic. But just within the 15 days of the happening of pandemic, the government came out with the regulations on telemedicine. I mean, clearing the pathway for the practitioners to start practicing telemedicine. So these are all, I would say, path-breaking steps and in a way, path-breaking innovations.
So, moving ahead, what is the one thing that you wish we could change in Indian healthcare in the future?
Well, I know it is a wishful thinking, but what I wish is that the healthcare should become affordable and equitable in the country. Presently, I think that the state of affairs of healthcare delivery or infrastructure, especially in tier 2 and tier 3 towns, a lot I would say, a lot is left, which is to be desired. And we have not even done a gap analysis of the healthcare delivery in tier 2, tier 3 towns. We don't even come out with the statistics which are district wise. For example, when you talk about the ratio of that, how many beds do we have in the country, we all get a uniform figure for across the country, and which is totally absurd because the ratio in the city of Delhi or NCR and the ratio which will be there just about 80-90 kilometers away from it, maybe go towards Roorkee or some other place, starts becoming hugely different. So we must make, I would say, use of technology to make healthcare equitable and affordable. We should embrace holistic medicine and work very hard to make healthcare safer. And one of the ways would be that I wish that we empower our family physicians, and especially with the help of technology, they should become a very effective first filter. We need to bring about changes in medical education systems so that a medical graduate feels empowered to work in the community. And this is sadly lacking today.
Moving ahead, we've observed so many innovations through this pandemic duration. So, my question to you is, would you like to highlight some innovations that you saw during the last year that you find promising?
Well, this is definitely an area where I have been, I will say, I'm very lucky. I'm very proud that I am been presiding an organization called CAHO, which is the Consortium of Accredited Healthcare Organizations. And this organization has been, I would say, promoting innovations in healthcare for a very long time. So we do a annual event every year where what is called as a CAHO Tech. In fact, the one of this year just concluded day before yesterday. So this particular, I would say, event, we have a one day which is kind of totally dedicated to allowing startups which may have brought some disruptions or some good ideas or proof of concept is there. They are able to present their issues there. And same way, we have a one separate day where hospitals are asked to submit the best innovations that they might have embraced or they might have implemented. So I will say that very interesting and very innovative solutions are there. It will be very difficult to, name all of them, but some of them which come to my mind, I think last year we had this Meenakshi Mission Hospital coming out with a Bluetooth stethoscope, which was made out of just an ordinary stethoscope. It was quite effective. And the cost of making a Bluetooth stethoscope was like 1/20th the cost of the any kind of a product, international product, which may be available in the market. And similarly, there were a product made by the hospital in Chengalpattu, our Sriranga hospital, from by one Dr. Anuradha, who is also the chairperson of the individual professionals in CAHO, and they made a kind of a UV sterilizer for the kind of the for sterilizing certain products. Now, similarly, this year, and again, even last year, we had nice products coming from Arvind Eye Hospital, and they had made very low cost, very innovative solutions, which were making, I would say, a huge impact in ophthalmology practices, especially during the COVID times, that how in helping the patient remaining at a distance and still they are able to kind of examine. There is a government Amarindra Medical College in Tamil Nadu, and they are coming out with a COVID test which is based on nanotechnology, and the results will come out in seconds. And that particular thing is lying at the moment, I think, with ICMR for validation and approval. So what I can say is that there are a huge number of products. I mean, we have somebody who has now come out with a speech recognition software, so that the doctors, when they speak, it automatically kind of generates kind of prescription. There are products which are going to help you identify the bacteria very, very fast, so that we are able to give appropriate antibiotics. And I would say many, many more.
Now, continuing the talk on innovation, would you like to share your own work linked to healthcare innovation?
Well, as I said, that our work, in the sense that you can imagine that one of the main activities that CAHO has been doing is to start, we have been holding training programs. And all those training programs were physical training programs. We hold more than 25 training programs in the country. But ever since pandemic and since the travel was totally restricted, so therefore a lot of programs have now been made online. Number of the programs have been made self-paced, and they have been very, I would say, very effectively, they have been accepted by our members, various people in the hospitals. We have been able, so what we also did, that we brought in international experts because of the power of the, I would say, internet. So we have, like on every first Tuesday, we do an international webinar series, which is in association with ISCOA. On every last Saturday, we do a continuing quality education series in association with the Asian Society for Quality. So a number of, I would say, programs and number of, I would say, experts, which were not possible in normal times. It was not possible to get hold of them. I think we have been able to get hold of them and to make it accessible to all our people. In fact, we have now the kind of this activity that we were doing, we have been able to take our footprints outside the country. And so you can imagine that now the number of programs, especially my international webinar, is being attended by people from more than 20 countries on that particular day. So I will say that these are all steps of innovation. And again, the other thing is that the one problem of innovation is that some people may have done it in their own place or own hospital, how to propagate it. And that's, we have played a role in trying to propagate the right kind of innovation so that others can also embrace and make use of it.
That's a good perspective, sir. And I believe that the cause is just cause, and propagating the innovations would enable the society and the country as well as the world to get the true benefits from that particular innovation.
Absolutely. We must say that our tomorrow is better than our today and yesterday.
True, sir. So coming to the next question, I would like to ask you, what inspires you in your work? Say any individuals you idolize and why you idolize them.
You see, what inspires me today, especially, I would say that I have seen people working with, I would say, extreme hardships, and they are delivering, they are working, they are kind of giving their best, they are making the society still, I would say, go on and on. Let's say we are fortunate in lot of ways that, so whenever I look at, I mean, recently when you look at the stories of the international, our Olympic women's hockey team, or even some of the men's hockey team, or some of those people, I look at the people, who are excelling under, I would say, extreme hardships. I think that inspires me, that propels me to go on and on. And of course, if I look at people, I look at people all around me. I think this whole world is like an ocean, and you have to look at people just around you, and you will find a lot of inspiration. I mean, we have in our organization, in my organization, my CAHO, so we have patrons, and especially led by Dr. Girdhar Gyani, who was the founder of Quality Movement in our country. So he inspires me. My own Secretary General is Dr. Lalu Joseph. She's the Secretary General of the organization. And of course, she is also holding a very important position in CMC Vellore. And I marvel at how this young person is able to do things both for the organization as well as for for our organization as well as for the institution that she is serving. I mean, today, at least I don't have to kind of work for any other institution. So I'm fully trying to devote myself to this organization. But I find examples of inspiration, I would say, almost every day, and that's what keeps me propelling, that keeps me going on.
That's a great point you delivered, sir. Finding inspiration is not difficult. Just people need to change their perspective or say outlook towards the world.
Absolutely. I find that you have to look at how much people are kind of working, and I'm really, really blessed. And I feel that people have to have more love and compassion in their heart to be able to be inspired.
True, sir. So moving ahead, like people or say personality, we've come across many resources, say like books, quotes, or maybe speech of a particular person. So I would like to ask any books or resources you would like to share with our listeners that you found enriching in general or focused on healthcare.
Well, I would say that today we are in such a lucky era that you just have to go to internet and you start listening to some of the TED Talks. They are very inspiring. They are very, very, I would say, valuable in helping you remain positive. But I must say that most people, I would say, at least in healthcare organizations, especially, my emphasis would be that people should work towards developing the leadership qualities. And towards that, I will definitely recommend a program which has been developed with a counterpart in Canada, led by one Mr. Graham Dixon, and therefore leads Global Canada, and CAHO has come out with a program on leadership. And I will very strongly recommend as to people should kind of undergo. That's a self-paced program. You can finish it in the next 4 to 6 months, but I think it's a good value for money. But I will say that the opportunity to learn is huge. And one thing I will say that at the end of the day, I think at least you should have learned something new every day. Whether I can say, I'm spending now my time in Uttarakhand, and I knew very little of gardening. I knew very little about birds. I am learning such a lot about various things, how to grow Asiatic lilies, Oriental lilies, and many flowers. And likewise, I mean, I had even to know the names of the birds, that it is a red-billed Leothrix, and this one is a minivet, and this one is this, and this one is that. It's so exciting that every day you should be able to learn. And I think if you do that, that will keep you very energized and focused.
So now for the last question, I would like to ask, where can our listeners connect with you?
Oh, they are welcome to send me an email at vijayagar@gmail.com, VIJAYAGAR @gmail.com, or my phone is 98187660000, and you can WhatsApp to me.
The link to connect with our guest speaker, Dr. Vijay Agarwal, will be down in the description. Before concluding, I would like to thank Dr. Vijay Agarwal for joining us and sharing your perspective. It was a pleasure having a conversation with you and an enriching experience.
Thank
you, sir, for joining us.
Thank you, sir.
To conclude, I would like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. If you have a healthcare innovation journey of your own, do connect with us. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host Rohan Tandel from InnoHealth Magazine Studio. Thank you.